Oh, so here we're discussing about the depolarization and hyperpolarization. So what those two means, okay? So this is the plasma membrane, okay, semi-permeable. This is extracellular fluid. This is the cytosol inside the cell. So once a neurotransmitter comes and attaches to a channel here, this is a ligand-gated channel, and that will open up the sodium. It can also be calcium, but sodium here, let's talk about it, can come here. So when they come here, inside the cell become what? More positive. So normally before the stimulus, it was negative 70. Once the ion enter, it become less negative, okay, or more positive. So that is called depolarization. Entry of the positive charges inside the cell become more positive. That's called depolarization. But if you have a different situation here, so this is the plasma membrane again, there's two different channels here. So a neurotransmitter comes, and now the potassium leaves. The potassium is positively charged. So if the potassium leaves, inside the cell become what? More negative. Or a different type of neurotransmitter can come, and more negative ions like chloride enters the cell. And this will creating inside the cell more negative. Okay, in that case, normally at rest it was negative 70, but now inside the cell is more negative because positive charge left or negative charge entered the cell, and now is negative 80. So farther away from 0. Okay, so it became more negative. So now that is called hyperpolarization. Hyperpolarization, becoming more negative. We are always talking about inside the cell, okay, not outside of the cell, inside the cell. So now what is graded potential? Okay, so this is a plasma membrane of a neuron here. So outside is positively charged, inside is negatively charged. So a stimulus comes here, and that stimulus changes this plasma membrane potential. Depends on the type of the stimulus, inside the cell may become more positive, or it may become more negative. Also depends on the stimulus. The stimulus may be small, okay, so it may not travel that much, or it may be bigger, so it may travel further away. But there is a cytosol is here, okay, and that will prevent movement of the ions further. So this is why one of the characteristics of graded potential is that it will not travel long distances. It decays. It decays. So it means it will fade it. It will not go to the further distances. So that is happening. Graded potential happens in the dendrites in the cell body, and also it can happen in axon hillock and postsynaptic membrane. Compare that with action potential here. So action potential happens in the muscles and axons, okay? So here at rest you have negative 70. If there is a stimulus comes here, and if the stimulus is strong, that can cause depolarization. Remember, depolarization means the cell become less negative or more positive. So if it goes above a specific millivolt, that varies from one neuron or one tissue to another, that is called the threshold. If it goes above that, then it will cause an action potential. If it does not go above that, it still causes depolarization but not action potential. This is why action potential is called all or none phenomenon. All or none. Either it happens or does not happen. So if it happens, then it must go above the threshold. So from negative 70, it goes all the way to positive 30. So there is 100 millivolt changes. And it also goes to long distances. Okay, it does not decay, and it can go from one area to another area, and that will transmit information. So for the action potential, you have the sodium channels and you have the potassium channels. Sodium channels have two types of gates, okay? So these are voltage gated channels, okay? We are talking about the voltage gated channels. So respond to the changing in the plasma membrane potential. One is activation gate. So normally they are closed. They will prevent movement of ions inside the cell. Once the stimulus comes, they will open up and the ions enter the cell. Normally they are closed. Inactivation gate is just the opposite. Normally they are open. Okay, normally like this, they are open. Once the stimulus comes, the ions enter the cell, and once you get to 30 millivolt positive, 30 millivolt, they will close, and it will prevent further movement of the ions inside the cell. So the activation gate normally is closed, inactivation gate normally is open. So it's just the opposite of each other. And the sodium channel, so this was the sodium channel, okay? Now is the potassium channel. The potassium channel has only one voltage sensitive gate. And normally it is closed and it slowly opens up. So the gated channels, as I said before, they require ATP. They are closed normally at rest. The leaky channel, they do not require ATP and they are normally open.